We talk a lot about drug overdoses, but rarely do we think about the risk involved when it comes to seniors. The rate of drug overdose deaths among adults over the age of 65 increased more than 11% between 2022 and 2023. The majority of these cases are unintentional. Well, now there's an effort to educate seniors, their families, and caregivers. Senior health correspondent Monica Robbins joins us now to explain what we all need to know about this. Good morning, Monica.
Good morning, Danita. Yeah, medications in older people can often be a complicated mix. Their metabolisms are different, their cognitive function may be slightly off. Regardless, accidents can happen, and seniors and caregivers need to know the risks. So joining me now is Alan Neville, who is part of a group trying to provide valuable information to those who need it most. So thank you so much for being here.
Thank you for having me. I appreciate it.
So why are you doing this?
Well, I've got a personal story to share. So I'm now in my 60s, and I can't tell you how many times I'm not sure whether I took my medicine each morning. Sometimes it'll be in my pocket, other times I'll take it, sometimes I'll actually double up. And fortunately, the medications that I'm on don't cause any harm. But when I found out about the fact that so many people are overdosing over the age of 65, it was startling, but it also brought it home for me. So what we're trying to do is create a level of awareness within the community among seniors, those who care for seniors, community healthcare professionals to address this rising problem that we have.
When you heard about the statistics and heard the issue, what went through your mind?
It was me. It became very personal because I thought about the fact that, again, the medications that I take, if I were to double up accidentally, don't cause any harm. But how many people don't know that? You know, one of the things that we found out doing our research was the fact that quite often seniors will share meds. You got a backache? Here's a pill for you to address that. Not knowing how that counteracts with other medications that you might be on. The other thing is the fact that this impacts our youth as well, because the second fastest growing group are toddlers. So you think about the little pill containers that you have, you know, Monday through Sunday. Those are very easy to open. So toddlers are getting into those, and they're accidentally overdosing as well. So I think this is a program that benefits not only seniors, those who care for seniors, but also gives you some insight as to what to watch out for if you have toddlers, grandkids, great-grandkids running through the house.
And those Monday through Sunday pill boxes, I mean, that's what I need to manage mine. But even those are the things that, you know, people can forget because I've done it.
Absolutely, absolutely. So what we're trying to do is share safe practices in terms of storing of medications. It's interesting because those are a lot of things that we just don't think about offhand. So we want to raise that level of awareness, and we're really excited about having this event. We had it in Central Ohio back in April, and it was very successful. So the goal is now to bring it to Northeast Ohio.
When you did the one in Central Ohio, are you finding that a lot of people don't realize that their medications or pharmaceutical medications, are you telling them about the mixes between those and supplements as well? Because I wonder if a lot of people don't realize that your supplements are medication too.
Absolutely. So one of the great things about this program, we will actually have pharmacists on site. So you can bring your list of medications and they can share information such as that in terms of the difference between the medications and the supplements. And sometimes there may be some negative reactions between those that you're not aware of.
So make sure, bring your list of supplements too, no matter what it is that, you know, that omega-3, you know, fish oil that you're taking.
Yeah, definitely.
So who else is going to be on site, and when is this event?
So the event is actually presented by MAC. It's an organization out of Central Ohio. MAC stands for Multi-Ethnic Advocates for Cultural Competence. It's presented in partnership with the Weatherhead School of Management at Case Western Reserve, in Tethic, and then also WellLink in the Northeast Ohio Opioid Consortium. So what we're looking to do is we'll have workshops. We're going to help you. If someone does accidentally overdose, what do you do? So we're going to have naloxone kits. We're going to do training for that. We're also going to have a really interesting interactive game that allows you to work on your cognitive abilities, because as you get older, we know studies have shown that your cognitive abilities tend to decrease. So what can you do to stay sharp?
So this event is Tuesday, September 23rd?
Yes.
From 10 a.m. to 3 p.m.?
You got it.
And I think there's a QR code that we can put up that will link you to the story, and if not, we will make sure people know how to find it. And I put all the information there to get people so they can register for this event.
Yep, at Case Western Reserve University on the 23rd.
Alan, thank you so much. Great
Thank you for having me. I really appreciate it.
All right, Danita, back to you.
All right, Monica, thank you so much. Well, travel news now.